the Centers for Medicare and Medicaid Services continue to offer Section 1135 waivers to grant states and territories flexibility in their state Medicaid program. As of April 15th, CMS has approved 52 Section 1135 waivers. This is to states and territories such as Puerto Rico, the Virgin Islands. Some states have not yet requested their flexibility. That is expected to come in the weeks ahead. The state of Wisconsin, where we are, just got their own legislative approval for their Department of Health Services to ask for some flexibility from the federal government. So we know more is coming. The Centers for Medicare and Medicaid Services consider these urgent regulatory relief to ensure that states and territories can quickly and effectively care for their most vulnerable citizens. Now, it's not just this one type of waiver that CMS has been approving. In total, they have, to date, approved 52 emergency waivers, these 1135 waivers, 31 state amendments, 11 COVID-related Medicaid disaster amendments, and even one CHIP COVID-related disaster amendment. And that's specific to the Children's Health Insurance Program. All of them give states a little more flexibility in the rules of administration, in delivery, in enrollment, and eligibility in different types of Medicaid programs and systems. Now, states are using the toolkit that CMS put together to expedite the application process. It then also makes sure that these approvals go as a little bit quicker as well. And this has been a record number of Section 1135 waivers that CMS has approved in a very short amount of time. Now, there is also additional flexibility that is being granted by the Centers for Medicare and Medicaid Services, and it's not directed specifically at states or territories. We have a separate video talking about Section 1135 blanket waivers. These are waivers that come right from the center, from CMS itself, to temporarily suspend a number of rules that have blanket provisions across the United States, so states and providers don't have to specifically request them. CMS pushes it out themselves. In addition to the blanket waivers that CMS issued back at the end of March, on March 30th, they have issued additional Section 1135 blanket waiver relief that allows things like letting hospitals, clinics, and other healthcare facilities boost frontline medical staff. And Centers for Medicare and Medicaid Service Administrator Seema Verma said it's all hands on deck during this crisis. They want to make it easier for other people that typically might not be working in a primary healthcare or frontline role to step in and fill that need, especially in cities like New York, where the need is dire. Now, we do link to the updated Medicaid State Resource Center website and that press release on additional blanket waivers in the description below.